Hello everyone, I am Dr. Swati Mehta and in this video on anorectal dysfunction in pregnancy, we will discuss about the anal rectal dysfunctions, which includes anal fissures, fecal incontinence, pruritus ani, proctalgia fugax, abscesses and fistula, including homeopathic remedies and why this issue arises during pregnancy. An anal fissure is a small tear in the anal canal. It commonly occurs due to constipation, passage of hard stool, chronic diarrhea during pregnancy. Patient complains of severe cutting, tearing pain during and after stool. This picture shows about anal fissure. On the right side, it is a real human body's picture. On the left side, it is a animated one. Causes of anal fissure during pregnancy are hard stool from constipation, hormonal changes which relaxing the anal muscles during pregnancy, and there is low fiber diet, low fluid intake, and pressure from growing uterus on the rectum during pregnancy. Other general causes for other patients normal than the pregnant woman, we can find out trauma from hard stool, ischemia, prior anal surgery or anal sex, inflammation of anus and rectum, Crohn's disease and inflammatory bowel disease. There is elevated anal pressure. Symptoms of anal fissure are pain during bowel movements, there is bleeding and itching at anus, cracked skin at anus, pain like passing shreds of glass, aggravated after stool. Anal fissures usually heal without treatment, or you can say non-surgical treatment, where we have to advise patient to have stool softeners, but during pregnancy we have to must take precautions that she must not have large amount of stool softeners. Cyst bath and other lifestyle measures are also has to be improved. A high fiber diet, drinking of lots of fluids and regular exercise during pregnancy or antenatal period is must. She can have local anesthetic jelly can be used, which is applied at the area of anus to relieve the pain. In homeopathy, remedies are selected based on characteristic symptoms such as burning, splinter-like pain, etc. So when I am narrating or showing the therapeutics, you must find out the peculiar symptoms in each and every medicine. The first medicine in my mind always is Retania. The patient experiences a marked feeling of constriction in the rectum as if the anus is tightly contracted. The pain is usually aching in character, but at times it may become sharp and intense. There is a very peculiar sensation as if the rectum is full of broken glass. So this is very peculiar symptom. Patient will tell you. Splinter-like pain, which is highly characteristic. The pain may be temporarily relieved by cold water application. So patient always suggests that I want to put cold water or cold pack on that area. The anus aches and burns for hours after passing stool. Burning is intense and may be described as fire-like burning. This is also a sensation of dry heat in the anus with sudden knife-like stitching pain. Stool does not pass easily. It must be forced with great effort, and there may be protrusion of hemorrhoids during straining. So Retania can be used for both, for the hemorrhoids as well as for the anal fissure. Marked anal fissure is more indicated in retania. There is great constriction and burning like fire, similar to hemorrhoids. And again, the pain is temporarily relieved by cold water. This patient may also suffer from fetid thin diarrhea when the stools themselves cause burning. There may be burning pain both before and after stool. Sometimes there may be oozing from the anus, and in some cases, pinworm infestation with intense itching around the anal region. So, these are the keynote symptoms which help us to individualize the case and select the most appropriate remedy. Peonia is the second medicine which can be indicated where there is anal fissure, fistula, and painful ulceration around the anus and perineum. The patient complains of biting and intense itching in the anus, and the anal orifice may appear swollen and inflamed. There is marked burning in the anus after stool, and interestingly, this burning may be followed by sensation of internal chilliness. See, in the retania, patient is better by cold water. Here in peonia, patient feels chilly after the pain. In case of fistula in ano, especially when associated with diarrhea, there is persistent anal burning along with the internal chilliness. It is useful in painful ulcers of the perineum which oozes offensive moisture. So patient always said that the discharge is foul smelling at the site of anus and I am feeling very bad. Hemorrhoids, fissures and ulcers appear purple in color, may be covered with crusts. One of the most striking feature is atrocious pain during and after every stool. The pain is severe, long-lasting and causes great suffering to the patient. There may be also sudden pasty diarrhea accompanied by faintness or weakness in the abdomen. So whenever we find violent post-stool pain, burning followed by internal chilliness, offensive oozing ulcers around the anus, which are purple color, crusted, fissures and hemorrhoids, we can think about peonia. Let us discuss another very important remedy, that is graphitis. Graphitis is especially useful in cases where there is chronic fissure, hemorrhoids, fistula, or ulceration of the anus and surrounding perineal region. The patient complains of biting and intense itching in the anus, and the anal orifice may appear swollen and thickened. There is marked burning in the anus after stool, and this may be followed by a peculiar sensation of internal chilliness, the same as of peonia. In case of fistula in ano, particularly when associated with diarrhea, the patient experiences anal burning along with internal coldness. A very characteristic feature of graphitis is the presence of painful ulcers that oozes an offensive sticky moisture. The discharge is often thick, gluteous, and irritating to the surrounding skin. Hemorrhoids, fissures, and ulcerated area may appear purple, unhealthy, and covered with the crust. It's the same indication you can find out in peonia. There is severe distressing pain during and after stool, which lasts for a long time. There may be sudden pasty diarrhea accompanied by weakness or faintness in the abdomen. So whenever you observe chronic fissures with sticky offensive discharge, cracked crust, unhealthy skin around the anus, burning after the stool with internal chilliness, persistent itching and swelling, we can think about graphitis. Also, we know that there is gushing leukorrhea in graphitis and chronic constipation in graphitis. The constitution of graphitis patient is flabby, dark complexion, opposite to the pulsatilla. Nitric acid is indicated when there is a great straining during stool, but very little pass. The patient makes repeated efforts, yet the evacuation is unsatisfactory. A very characteristic symptom is sensation that the rectum feels torn. The patient may be describe it as if the parts are raw or injured. There is a marked constipation associated with fissures in the rectum, and the stool causes intense suffering. During stool, there are tearing pain. More importantly, there are violent cutting pain after stool, which may last for hours. This prolonged post-stool pain is strong keynote of nitric acid. The other medicines also having the prolongation of the pain like peonia or graphitis or even retania. But nitric acid is more important for long-lasting pain after stool. There may be profuse bright hemorrhage from the bowels, and the hemorrhoids tend to bleed easily. So this medicine is also used for bleeding hemorrhoids. In some cases, prolapse ani may occur due to weakness and constant straining. So prolapse of anus is common with nitric acid. The patient may also experience slimy offensive diarrhea and after stool, which feels extremely irritable and exhausted. So weakness after diarrhea we can find out in graphitis, even in peonia, but here exhaustion is more because it is acid group medicine. The most guiding symptom is pain described as if caused by splinters, sharp, sticking, pricking pain in the rectum. That means splinter-like pain, cutting pain with long lasting after the stool, bright red bleeding and hemorrhoids, fissure with intense tearing pain, then we can think about nitric acid. Anorectal abscess is a collection of pus near the anus caused by infection of anal glands. A fistula is an abnormal tract between the anal canal and the skin around anus. It often develops after an abscess. There is a persistent discharge, recurrent swelling, and pain and irritation after formation of fistulae. In conventional medicine, surgery is commonly advised. However, homeopathy offers a non-surgical approach in selected cases by addressing chronic infection tendency and improving healing. This picture shows different sites of the fistula. High transsphincteric, internal sphincteric, superficial fistula, and transsphincteric fistula. Causes of anorectal abscess and fistula during pregnancy are clogged anal glands, constipation, any prior infection, or there is hormonal relaxation which weakening the tissue. In case of general anal fistula without pregnancy, it occurs in any of the male or female. The causes are diverticulitis, cancer, tuberculosis, or there is radiation therapy for cancer treatment that causes anorectal abscess and fistula. Patient describe pain and swelling around the anus, or there is history of frequent anal abscess, pus found any opening near the anus, bleeding, there is fever, or there is fatigue. Patient feels chilliness because of the infection. During pregnancy, we can diagnose by examining the rectal region or the area from where we can find out the fistular tract because the pus is coming out that we can observe. Or we can go for ultrasound or MRI of the anal area. But fistulotomy is not advisable in pregnancy. During pregnancy, you can advise it after if she is not able to recover from fistula, then she can go for surgery. But to avoid surgery, we must use homeopathic medicine and it will give the best result. Homeopathy creates a miracle in case of anorectal abscess and fistula ano. I have treated many of the cases of anorectal fistula, and some of the cases had operated for the same twice, and then surgeon is advised not to go further surgery, and they took homeopathic medicine and they completely cured with our medicine. So I am proud of the homeopathy. Now let us discuss the miracle remedy known as silesia. It is indicated when anus feels paralyzed. The patient has sensation as if there is no power to expel the stool. It is a leading remedy in fistula ano, where there is history of chronic recurrent cases. There is marked pain with spasms of sphincter in case of fissures. Stools comes partly expelled and then it recede back is the peculiar symptom of silesia. There is great straining and the rectum may sting severely. The sphincter seems to close upon the stool and it preventing the proper evacuation. Feces remains for a long time in rectum because of this weakness and lack of coordination. Important clinical point is constipation before and during menses. If it is associated with a patient before pregnancy, we can use this medicine. There is a diarrhea of cadaverous order indicated unhealthy suppurative process. The main cause we can consider is ill effect of vaccination. Another key feature is its ability to promote suppuration and ripen the abscess and making it valuable in anorectal abscess and fistulous conditions where the fistula and infection is ripened and then everything will come out. The normal development of the cells and patient is free from the disease condition. And constitutionally, if consider the silesia patient is chilly, cannot tolerate cold weather, patient hugs the fire and desire plenty of warm clothing. So patient always comes with the warm clothes and you can by observation find it out. So when you see stool recede after partial expulsion, there is paralyzed feeling of the anus, painful fissure with sphincter spasm, chronic fistula with suppuration, and patient is very chilly, desire always warmth, think about silesia. Lachesis is indicated in cases of constipation with offensive stool. The stool is often foul smelling and difficult to pass. The patient described a peculiar sensation that the anus feels tight as if nothing could pass through it. A characteristic symptom is darting pain shooting up in the rectum whenever the patient sneezes or coughs. So this is very peculiar symptom we can say. Hemorrhage from the bowel and blood may appear dark, sometimes described as containing black particles like charred straw. The hemorrhoids tend to protrude and becomes constricted, appearing purplish or dark in color. There are also stitching pain in hemorrhoids, aggravated by sneezing and coughing. Constant urging in the rectum, but not necessary for stool, is the guiding symptom. There is persistent sensation as if something needs to be expelled. Lachesis patient, you know, this jealous and suspicious and loquacious. So these symptoms we can find it out in patient with there is tight constricted anus, purplish congested hemorrhoids, darting pain upwards on coughing and sneezing, and dark offensive discharge. We can think about lachesis. Generally, Berberis vulgaris is a medicine for renal function disorders, but we can use it for fistula, ano, and fissure, as the symptoms are stool may be painless and clay colored, but can cause burning and smarting in the anus and perineum. There is constant urging to pass stool. There is tearing pain around the anus and even fistula in ano. Patient is having wandering radiating pain. This is the unique or key fissure we can consider for berberis. Pain that moves from one place to the other and sometimes extending to the lower back or the thighs. Sensation of tight cap pressing upon the scalp that shows how homeopathy sees the body as a interconnected. On the other hand, tuberculum represents a miasmatic tendency. It is often considered when symptoms are recurring, chronic, or hereditary, showing a pattern rather than isolated complaints. This remedy may help with persistent anorectal discomfort, irregular bowel habits, and underlying constitutional susceptibilities. So, tuberculum we can use as an intercurrent remedy in case of anorectal abscess and fistula in ano. Fecal incontinence during pregnancy, that means loss of control over the bowel movement or leakage of the stool, and this can happen in some women due to the severe pregnancy related changes. Fecal incontinence in general is known as liability to control the bowel movements that causes stool to leak unexpectedly from the rectum. The muscles or the nerve damage may be associated with the aging or with the giving birth. So fecal incontinence we can find out postnatally also. Fecal incontinence includes the inability to defer the elimination of gas, which may be equally socially embarrassing. In case of minor incontinence, while passing gas, patient also have some discharge of stool. In major incontinence, there is involuntary excretion of the feces. Generally, we can find out the fecal incontinence most commonly after the age of 65, but it is also common during pregnancy because of the pregnancy changes and the weight of fetus which is growing in the uterus. Causes during pregnancy. The first one is pressure from the growing uterus. Because the baby grows, the uterus presses on the rectum and pelvic floor muscles, and this pressure can weaken the bowel control, which cause leakage, especially in the later pregnancy. Weakness of the pelvic muscles and floor, that is the second cause, where the pregnancy hormones, especially progesterone, relax the muscles and ligaments, and the pelvic floor muscles support the rectum and anus. So when they weaken, they control may reduce, and because of the reduction of the control, patient develops fecal incontinence. The third cause is constipation and overflow leakage. That is very common because constipation is very common during pregnancy, and hard stool may get stuck and the loose stool can leak around it. Fourth one is diarrhea during pregnancy, and because of hormonal changes, diet changes, infection, or iron supplement which we have to give during pregnancy, and that causes diarrhea. That is the one of the cause. The fifth cause is nerve pressure or damage. The position of the baby can press on the nerves that control the bowel movements, and this may reduce the sensation or muscle control. Previous childbirth injury, that means when patient is having earlier vaginal delivery with episiotomy or anal sphincter tear, may have the high risk during the later pregnancies. Hemorrhoids or rectal problems, that is swollen veins, rectal prolapse, or inflammation can also contribute the same. In general condition also, the causes are same. Fecal incontinence may occur temporary or it chronic and recurring, but that causes embarrassment, voluntary isolation, depression, and patient is having economic burden, and that causes pressure ulcer too. These are the methods to diagnose fecal incontinence, but not during pregnancy. Those who are non-pregnant woman or a man, we can advise ultrasound or MRI or electromyography or difficography, and from that we can diagnose the anorectum fecal incontinence. To prevent fecal incontinence, first of all, we have to reduce the constipation, control the diarrhea, and avoid the straining. In homeopathic therapeutic, we can find out the symptoms which are described by the patient as in temporary incontinence while sneezing or coughing, patient passing some part of stool, or patient cannot control and there is a continuation of the stool. We are having certain medicines where patient is having the same type of symptoms. Aloes is the first medicine you can think about fecal incontinence, where we can find out constant bearing down sensation in the rectum, accompanied by bleeding, soreness, and hot sensation, and this is relieved by cold water. Pa- Patient may experience feeling of weakness and loss of sphincter control and creating a sense of insecurity. Patient is never quiet and sure that while passing gas, she is passing stool also. The stool passes almost unnoticed and sometimes lumpy, watery, or jelly like, and may leave the rectum sore afterwards. It also present with excess mucus in the stool, where sometimes painful after passing, and the hemorrhoids that protrudes like grapes. So grape like hemorrhoids. So this medicine is also used for fecal incontinence. It is also used for hemorrhoids where patient is better by cold application. In addition, aloes may indicated for constipation with heavy pressure in the lower abdomen and diarrhea that is triggered by beer or other irritants, reflecting how the remedy addresses both weakness and irregular bowel function. You can see here. Remember that homeopathic remedies are individualized and the specific sensation, stool type, triggers, and help the guide that choice of aloes. The second medicine we can think about is China, where patient experience much flatulent colic, often relieved by bending double. There is a tympanic swollen abdomen. Pain may localize to right hypochondrium, and there may be history of gallstone, or there is a liver and spleen dysfunction, and there may be enlargement of liver and spleen. Patient may have feature of jaundice, and there is internal coldness in the stomach and abdomen, along with gastroduodenal catarrh. Patient may be apathetic, indifferent, and disobedient. Suja is often indicated in patients with distended abdomen and induration, sometimes with chronic diarrhea, particularly worst after breakfast. Stool may be forcibly expelled with gurgling sounds, and there is a brown spots on the abdomen. Flatulence and abdominal distension are common with rumbling and colicky pain. Constipation may be occurred with violent rectal pain where stool recedes back like silesia. Hemorrhoids may be swollen, painful with sitting and stitching, burning sensation. The anus may be fissured. So anal fissure, hemorrhoids, fecal incontinence, we can consider thuja, and thuja is an antipsychotic medicine, so we can use as an intercurrent remedy too. Patient described that sensation of movement inside the rectum as if something is leaving but without any actual pain. So these are the symptoms of thuja and we can think about it. Podophyllum is often indicated for long-standing diarrhea, especially early in the morning, during teething or after bathing, or in hot weather following acidic fruits. So when a pregnant woman having some acidic fruits and develop fecal incontinence, we can think about podophyllum. Painless causeless diarrhea where there is green watery fetid profuse and gushing stool, and it is not caused by any venous status or intestinal ulcers. There is association of prolapse of rectum before or during stool. Patient experience constipation sometimes where the stool is clay colored, hard, dry and difficult. It is alternating diarrhea and constipation in this type of patients. Internal and external hemorrhoids. So this is also used for hemorrhoids. Podophyllum primarily affects the duodenum, small intestine, liver and rectum. So it is useful in pregnancy related digestive issues where pendulous abdomen after the childbirth and uterine prolapse. So this is very helpful medicine during pregnancy and after post pregnancy, that is after labor postnatal period, to remove the pendulous abdomen. Causticum is indicated in cases of fecal incontinence with soft small stool, sometimes like goose quill, or hard tough stool covered with mucus, shiny and expelled with much straining or only when standing up. Patient often experience pruritus, soreness and burning in the rectum along with partial paralysis of rectum. So partial paralysis is the indication of fecal incontinence. There is fistulae. So this medicine is also used for fistulae. And large hemorrhoids, burning, rawness and soreness. So all the anorectal dysfunction is covered in causticum. Emotionally, patient may be sad, hopeless and intensely sympathetic, with complaints often arising from long-lasting grief or sudden emotions. Even thinking about their complaint can aggravate the symptoms, especially the hemorrhoids. So, causticum addresses both the physical weakness and emotional sensitivity associated with the anorectal dysfunction. As thuja is an antipsychotic, sulfur is an antisyphilitic medicine, and it is also used in fecal incontinence with itching and burning of anus, particularly when hemorrhoids depends on the abdominal plethora. Patient may have frequent but unsuccessful urge passing stool which is naughty or insufficient, and sometimes redness and irritation around the anus. So when you find out redness around the anus, the sulfur is the indication. There is morning diarrhea which is painless but urgent and sometimes causing rectal prolapse along with oozing hemorrhoids and belching. There, there is a mental symptoms like forgetfulness, difficulty in thinking, and tendency for complaints to relapse. The discharge often has a general offensive character, and patients may experience light, restless, or catnap sleep. Sulfur addresses both the physical and constitutional tendency in anorectal function. So we can use sulfur as an intercurrent also and as an indicated remedy also. Proctalgia fugax is sudden severe rectal pain that lasts for a few seconds or few minutes. It is a functional gastrointestinal disorder characterized by severe and self-limiting anorectal pain. So this coming under SORA, and functional disturbance is there. The pain, spasms of rectal muscles, stress and anxiety are the cause. So again, we can consider it is a sora. The pain is sharp, graping, and coming out without warning. So homeopathy works well in such functional spasmodic conditions by treating the underlying nerve imbalance. All the medicines for constipation can be used for this pain. Pruritus ani means the intense itching around the anal region. Causes during pregnancy are the hormonal changes, moisture, hemorrhoids, dietary irritants, soaps, and infection. There may be other causes like diabetes, fungal infection at the anus, worm infestation, and patient may have history of diabetes. There is severe itching and which is aggravated at night or aggravated after stool, aggravated from the warmth of the bed. There is burning in the perineal area and aggravated by the scratching. The medicine used for fissure, fistula, and piles, as per the symptom presentation, we can use for the pruritus ani. The management of anorectal disorders in pregnancy involves lifestyle measures, diet, hygiene, and specific homeopathic medicines chosen according to the peculiar symptoms. Always consult a healthcare provider or a homeopath before starting the treatment during pregnancy. Thank you for watching. I hope this video helped you to understand and more about the anorectal health and homeopathic remedies. If you found that it is useful, then don't forget to like, share, and subscribe for more natural healthy tips. These remedies are meant to guide awareness, but always consult a qualified homeopath or healthcare professional for the personal treatment. Subscribe for more videos on the natural approach to digestive and anorectal health.